our study is entitled Bridging Thrombolysis versus Direct Mechanical Thrombectomy in Stroke Due to Basilar Artery Occlusion. Essentially, what we are hoping to look at is an international cohort study conducted across 8 comprehensive stroke centers in about 5 countries. We actually aim to determine if patients who receive bridging thrombolysis therapy prior to thrombectomy had better outcomes compared to patients who had received mechanical thrombectomy alone. I mean, most of the previous research papers that have looked at bridging thrombolysis were mostly done in anterior circulation strokes and not so much in basilar artery occlusions. And I mean, we hypothesized that bridging thrombolysis therapy prior to thrombectomy is probably associated with better outcomes in patients with basilar artery occlusion. So this was a multi-center retrospective cohort study. I mean, we recruited consecutive patients from participating stroke centers with acute basilar artery occlusion between January 2015 to December 2019. And prior to thrombectomy, all patients underwent neurovascular imaging with CT and CTA. And patients were considered for bridging thrombolysis if they presented within 4.5 hours of symptom onset, if they had no contraindications, and at the final discretion of the treating stroke neurologist. I mean, in each institution, thrombolysis was administered by an accredited neurologist at the usual dose of 0.9 milligrams per kg. Patients were considered eligible for thrombectomy if the procedure could be initiated within 24 hours of the time of stroke onset and had an angiographically confirmed occlusion in the basilar artery. And I mean, where we looked at the results, I mean, what we evaluated was, as a primary outcome measure, was a favorable functional outcome defined as a modified Rankin Scale of 3 or less after 90 days. And the secondary measures of outcome were in-hospital mortality, good functional outcome as measured by MRS of 2 or less after 90 days, favorable MRS of 3 or less upon discharge, and symptomatic intracranial hemorrhage. Looking at our results, our main findings were that we did not observe a significant improvement in outcomes for basilar artery occlusion acute ischemic stroke patients who receive combined bridging intravenous thrombolysis and thrombectomy compared to direct thrombectomy alone. However, on the subgroup analysis, we did find that bridging thrombolysis prior to thrombectomy was associated with better functional outcomes in patients with basilar artery occlusion due to underlying large artery atherosclerosis. And let me show you that. So this was the subgroup of patients who had underlying large artery atherosclerosis. And we see a favorable shift in the modified Rankin Scale in the bridging group compared to the direct mechanical thrombectomy group. And you see that the p-value is significant with an odds ratio of about 2.99, 95% confidence interval of about 1.4 to 6.2. Yeah. So this was the main finding that we found in our study. I mean, we can conclude from this study that in patients with ischemic stroke due to basilar artery occlusion, bridging thrombolysis was not associated with improved functional outcomes at 90 days. However, in patients or the subgroup of patients with underlying large artery atherosclerosis, a significant treatment effect of bridging thrombolysis was seen. And I think the equipoise as to whether bridging thrombolysis provides additional benefit over direct mechanical thrombectomy should be resolved in future randomized controlled studies, bearing in mind that this is just a cohort study, although it is a pooled sample from multiple centers across Europe and Asia.